In recent years, there has been a significant increase in the number of women joining the labor force across various sectors in Thailand. This is due to greater access to education, growing recognition of the importance of gender equality in the workplace, and many other factors. However, as more women pursue careers and contribute to the nation's economic development, the need to support them during critical life events has become even more pressing. One of the most crucial forms of support is maternity leave, which allows new mothers to recover from delivery, bond with their infants, and ease their return to work. Following these changes, there is an emerging conversation in Thailand regarding the need to increase the length of maternity leave to better accommodate women in the workforce and promote maternal and child health. Hello, my name is Gotchapan Thanapapavarit. Today, I would like to discuss the problems regarding pregnancy and maternity leave in the Thailand Labor Protection Act. According to the Labor Protection Act as of 1998, female employees can take no more than 90 days of maternity leave, which is approximately 3 months, weekends and public holidays included. Out of these 90 days of leave, the employer is entitled to pay for only up to 45 days per year, the amount equivalent to the employee's wages of a working day. This means that women are only paid a maximum of half of their wages altogether throughout the duration of the maternity leave. Although the maximum maternity leave period in Thailand has increased to 98 days following an adjustment from a couple of years ago, covering both pre and post delivery, during which the employers are responsible for 45 days of wages, with the Social Security Office of Thailand taking on the other 45 days, but with the limitation of 15,000 baht. The remaining 8 days are still without pay. Realistically speaking, the support funds are not sufficient, and as a result, most working class women are forced to rush back to work and are unable to use the total 98-day leave. With the current insufficient length of leave, pregnant women also continue working until the delivery day, even when they should not. This is to save as many leave days as possible to spend with their baby after the delivery day. Scientifically, humans need at least 90 to 100 days to adjust to major changes, and this also includes women with newborn babies who have just been through the whole process of pregnancy followed by the sudden fluctuation of hormones. Giving birth is physically demanding, and mothers need time to recover. Insufficient leave can lead to inadequate physical rest, increasing the risk of complications of prolonged recovery. The postpartum period can be emotionally challenging due to hormonal changes, sleep deprivation, and the demands of caring for a newborn. With only 3 months of maternity leave, mothers may experience increased stress, anxiety, and postpartum depression, which is a medical condition that includes deep sadness, anxiety, and tiredness that women may experience after giving birth. The early stages of a child's life are critical for emotional and cognitive development. Insufficient maternity leave can limit the time mothers have to bond with their newborns, which in turn can affect attachment and development. 3 months is also just half of the recommended time for breastfeeding, with UNICEF and the WHO recommending that a child be breastfed for the first 6 months since they were born. As this is impractical in most workplaces where there are no space for women to bring their child in and feed them accordingly, many families turn to milk powder far too soon, and that in turn adds to the family's expenses. Importantly, breastfeeding is a natural way to help mothers to recover better and to pass on the better immune system to the child. 3 months is too short for a mother and her child to build upon and could affect the child's mental stability in the long term. Furthermore, if the mother returns to work prematurely, the family may need to rely on expensive child care services, putting further strain on the family budget. To tackle these problems, the government may expand the duration of the maternity leave up to 180 days with wages fully paid, and with the absence not allowed to affect considerations regarding promotion and work performance. This is also in line with the recommendation by the Thailand Ministry of Public Health. Expanding leave in this way is also predicted to help with the nation's declining birth rate and its aging society. As the major causes of these declining birth rate and aging society are fear of financial problems related to having a child, fear of not having enough time to take care of them, and worries regarding not getting a bonus or promotion at work. According to Assistant Professor Sataram Thamabusadi, a professor in the College of Interdisciplinary Studies at Thammasat University, the number of Thai women taking maternity leave in a year is actually very low, even in companies where females make up the majority of employees. Expanding the period benefits the company by reducing employee turnover and associated training costs. Countries with good maternity leave policies are often developed, although this is not always the case. Developed countries tend to offer good maternity leave due to many different reasons, such as strong social safety nets, where many developed countries have robust welfare systems and social safety nets that prioritize the well being of families. Developed countries tend to have a high rate of female workforce participation, which also encourages policies like maternity leave to help support working mothers. These countries also generally have more resources and infrastructure to provide paid leave without harming the economy or the businesses. Additionally, they prioritize gender equality and well being of the children. Examples of these countries are Sweden, Norway, Finland, and Germany. However, some developing countries also provide significant maternity leave, often due to cultural or policy priorities aimed at improving health and welfare. Examples of these developing countries include Botswana and Costa Rica. Some developed countries may not have as strong maternity leave policies as others, such as the United States, which does not have a national paid maternity leave policy. This gap is often due to political, economic, and cultural factors rather than a lack of development. In, in conclusion, there should be an increase in support for working mothers, acknowledging the importance of balancing work and family life while ensuring the women can continue to thrive in their professional roles. Furthermore, better maternity leave policies can also improve gender equality and the well being of families as a whole, which in turn improves society as a big picture. This will help Thailand in moving towards being a more developed country.